Hey everyone, this is Dr. Matt with the Ethos Athletes Podcast, and today we're going to be going over nutrition and hormone optimization for men. And for our episode today, I have two guests. So Dr. Alexandra who's the co-owner of Ethos Integrative Medicine. She was in our last podcast where she talked about hormone optimization for women's health. Her specialty is women's health and medical aesthetics. And then we also have Kelli Michelle from Keep Moving Forward, who's been part of our nutrition series. So everyone, welcome to the show.
Hey, thanks.
Thank you. All right, so we're going to dive right into our questions today. So first of all, Dr. Matt, can you give us an outline on the basics of men's hormones? So if you have somebody that's coming to you for low energy, weight gain, low libido, things like that, the common things that men come in with, what are you looking for?
Yeah, it's a great question. Testosterone is going to be one of the hormones that men are typically interested in, and so when we're looking at hormones with men, testosterone is definitely going to be a big one. Some of the other ones that we're looking at are estrogen. Estrogen isn't just a women's hormone. It's important in men as well as thyroid and then cortisol. So those are the four basic ones that I look at. You can get a little bit more into DHEA and progesterone, etc. But aside from those four, I think DHEA is probably the one that holds the next most clinical value. And so that's kind of what we're looking at. When we're looking at individuals with low energy, so the three things that men are coming in to see me for are typically low energy, low libido, and then erectile dysfunction is actually another one. And so when we're looking at those three things, low energy can be a combination of issues with their thyroid. It can be an issue with their cortisol. It can be an issue with testosterone, or a combination of one or two or three. Right, so it can be any one of those, and so checking those is going to be important. And then when it comes to low libido, testosterone is usually the culprit with that one. Every now and then there's going to be some thyroid issue, but low libido is typically a testosterone problem. And then erectile dysfunction, it's a common misconception that erectile dysfunction is caused by low testosterone, and it can be, but it's number 4 on the list of things that are common causes for erectile dysfunction. Typically, with those things, you're wanting to look at blood pressure, cholesterol levels, and then blood sugar as well. So testosterone's after I check those 3, then I'll look at testosterone if that's an issue. But usually, there's a vascular problems, and so that's not a big correlation with it. But in general, those are the symptoms I see. The only other 2 symptoms I'm typically seeing as far as hormones are going to be guys who are having trouble working out, or they're not able to recover as quick from their workouts, or they're not able to build muscle as fast. That's usually going to be a testosterone problem. And then guys who are having a bunch of abdominal weight gain, or they're just having trouble losing weight or leaning out. That can be testosterone. That could be insulin. Those are the 2 biggest factors in general that I'm seeing for those. It can also be thyroid as well, but yeah, it's typically going to be one of those 3.
Okay, great. Can you talk to me a little bit about the safety of testosterone? Is there anything that you need to be watching when you're getting testosterone replacement to know that you're doing it correctly?
Yeah, absolutely. So when you're doing testosterone therapy, if you're doing a prescription-based testosterone therapy, and there's a few different ways to go about that, but at the end of the day, if you're doing that, you want to make sure that that you're getting screened properly prior to that. So what that looks like is, 1, do you have low testosterone to begin with? And the ideal way to check that is to run testosterone in the morning. So check the blood level in the morning. You want to do it twice before you want to have 2 separate times that you've run testosterone and that you've been shown to have low testosterone on 2 separate occasions. A lot of doctors will just do it the one time. That's not the ideal way to do it. You want to make sure it can happen twice, or it does happen twice. And to kind of prove that a bit, there was a patient that I had ordered testosterone on a while back, and what ended up happening was I accidentally checked the testosterone box twice on the lab order form, and so they actually ran the test twice without thinking about it, and the same blood sample, but testosterone came back 50 points different when they gave me the report for both tests. So it can fluctuate. And I guess that also goes to show you how accurate labs can be sometimes. But it can definitely fluctuate, and so you want to make sure that you are getting it run twice on 2 separate occasions, and that it's been shown to be low in both times. And then the other thing that you want to look at for screening is I always run estrogen with it. You definitely want a prolactin to make sure that there's no tumor or anything like that that's going to be causing these issues. It's rare, so I didn't say that to scare anybody, but that you do want to make sure that that's being done correctly. PSA is another big one to get a baseline before you start testosterone, as well as if there's a family history of PSA. Prostatic acid phosphatase is another one that you can, if there's a family history of prostate cancer, not PSA. There's a family history of prostate cancer, prostatic acid phosphatase is another one you want to take a look at. And then also getting the size of the prostate. And so those are a few different things that you want to get checked, and that should be checked prior to starting therapy, and they should be checked frequently while you're on therapy.
Okay, great. That's definitely good to know. Kelli, in your men that are experiencing weight changes in the libido, things like that, what are you seeing from a nutritional
They're very,
standpoint?
very secretive, so I have to build a major rapport with these men because I'm a female. Mm-hmm. So it's really difficult for me to get this out of them. A lot of them watch the live feeds that I do, and they're like, well, and they'll throw it into like their feedback just randomly. They'll be like, everything's, same as last week. I feel good. I have enough food. I'm still feeling pretty sluggish during my workouts. One thing that you mentioned was maybe I should have my testosterone tested. Like, I've never had that done. And then I'm like, oh, wow, this person's like in their late 30s. So I'll say, yeah, don't worry about it. It's a very simple thing. You go and get it done. And again, I usually recommend that they have it tested on 2 separate occasions as well, even if it's a month apart.
Yeah, absolutely.
Just to make sure that, because I've had labs switched on my clients with other people. Mm-hmm. One time I got a set of female labs and I go, this looks like a male's. You need to take this back in and tell them to redo your lab work because this is a male. They gave you a male's feedback.
Yeah.
And she was like, oh my gosh, you're right. And they were mortified. They ran the test and charged her a second time for it. And I'm like, no, they switched your labs with somebody else. Ask for that money back, because again, it's expensive. So with most men, what I will notice is the same thing that I notice with females is these men will come in and they will be eating in 1,000 calorie deficit. And what's interesting is you think women eat in such a large deficit. Well, they do for being women. The men by far eat in a major calorie deficit versus the women. Like they're, oh my gosh, So some of the men that are most overweight eat the least amount of food and gain the most fat.
Yeah, I've seen that to be true for sure.
So, and it's all in the midsection typically with people that are low test. Mm-hmm. But that's also a consistency area as well. So it's hard to say, like, I'll look at their data and I will see that same trend that I see with females, and it's not nearly as frequent, obviously, because a lot of men, even if they're in the 300s and 400 range, some men feel horrible at that range. Others don't feel anything at all. They have a sex drive. They don't notice that they feel just fine.
Yeah.
Right? So you probably know exactly what I'm talking about. But when we start to see it full force is when they start lifting weights. Mm-hmm. They're like, oh my gosh, I'm sore for 4 or 5 days. I've got their macros up, in a very sufficient area for muscle gaining, and they're not adding the muscle mass, but they're not really losing it. They're just not adding it.
Right.
And again, that could also be training stimuli. That's a little bit of a issue too. So, if we're looking at all of those things, I usually will recommend that they go and get their test done. Even just having the natural supplementation, going on the DHEA, can sometimes help with that. And they'll notice a major increase in their energy level, which is awesome because now that they feel a little bit better, they can train harder. Right? But then we also could see that those numbers come down the next time.
Exactly.
Because now they're training harder, they're under more stress physically. So it's kind of a catch-22. And again, I leave that to the experts to work with them. But as far as like with nutrition, I will see exactly the same trending in someone with low testosterone. It's basically what I would normally see with men is that if they're adhering to the macro protocol, and again, adhering means like 90% or better tracking every week, not eating out off their plan more than once a week, etc. Because most men can eat out even one meal off their plan, and I'm not talking about a cheat meal. I'm saying it would fit their macro profile, and they'll be down 1 pound to 1.5 pounds every week. Men are usually a little faster. Well, with the lower testosterone population, we see it closer to 1/4 pound to 1/2 pound a week, if anything. So it's that same stalling process when you're in a calorie deficit and you're adding food and the metabolism isn't working more efficiently because it's so suppressed. We have that same issue with, men. A lot of times their caloric intake is way, way lower. You know, we're talking like 1,000 to 1,200 calorie deficit on most men.
Yeah. So
I don't tell them that because I don't want them to be like, wow, I really suck. Because with men, I find you have to give them a lot more positive affirmation about anything. Yeah. Like if anything is better than the week before, you need to tell them. Where women, like, they're pretty good once you get them, in the flow of things. They're like, I know what to expect, 1/2 pound to 1 pound a week, and if it's before my cycle, I'm not going to lose anything. I'm like, you got it. Yeah. You got it. You're a champion. But with men, like, you really have to say, okay, cool. So we had your labs done, and 3 months later, they're gonna do them again. Is that correct? And that's the typical time frame for testing with a lot of the guys, especially ones that are on the injections, or pellets. And not very many men can go on pellets because they don't have the body fat to do it. Can't inject it into the muscle, or it's not going to work. Right? So with women, I think pellets work way better, and with men, obviously the injections work better. You can probably talk a little bit more about that. But they will give me their dosing, and what's really kind of neat with men is they correct pretty fast. Yeah, that's true. They definitely do. They do, so I can feed them more. Yeah. And they're like, man, now I'm losing. And so their metabolism is very different from a female. Metabolically, I see them snap back way more quickly with testosterone increasing. And again, it's like a doubling effect, right? Because women don't need that much. But their metabolism then is responding to the testosterone. And I would say, obviously testosterone is going to affect other hormones too. So maybe their leptin levels and ghrelin levels aren't so bad because now they're not as sleep deprived either. Right. Because alongside testosterone replacement therapy, I've had a long discussion with them about not getting enough rest and how important that is, and also for A1C. So we've got all these things that are now balanced, right? So we don't really know, is it this or is it this? Or is it all three of these things? Right. What's the biggest variable in the entire equation? But it's very great. I will say this, it's a very simple thing when men are like, hey, I'm going to go on testosterone. I'm like, hooray! Because I'm like, well, I mean, you are low. Your labs show that you've been low for several months in a row. And your labs from last year show that you were pretty low and you're actually a little higher. So I can maybe assume that you either have less stress this year, maybe you have been better with your nutrition this year, maybe you've been better with your sleep this year, or again, we've just got that marginal error in lab work, and it's been a year. Yeah. So a lot can change in a year, right? Many, many things can change in a year. So again, they've done a lot of studies on people who have had low functioning thyroid, testosterone, female and male, and have been going through a stressful or traumatic event in their life, a divorce, a loss of a family member, a death. And then years later, how does their hormone profile look with no changes to anything except for, that trauma? Right. And it's very interesting. So I always ask the guys in particular, have you had any trauma? And a lot of times they did just go through a divorce.
Okay.
They are having or experiencing issues with their relationship. I don't let them get too into detail with that. Just because, again, I'm their nutrition coach, and there are things that should professionally should be talked about and not talked about. So,
yeah, for sure.
Yeah. So that's why it's nice to send them to an HRT doctor that is a male, because they're not as scared to tell the male what's going on, because you're both males.
Right.
You know, where they're more afraid to tell the female, I think. And sometimes it is the same. A guy will be just as afraid to tell a male as a female. So.
And I've definitely seen that. And
yeah.
I mean, the one thing that, I mean, it's kind of one of those topics that guys shy around, and how they feel with this. And it's interesting to see, when a guy goes and tells me that they're experiencing some of these symptoms, I'll go and tell them, well, they always think that it's, it must not be that common. And so no, it's actually really common. I mean, I have a number of patients that I see for this, and you're not the only one. So
very common in athletes.
It is
very common.
It is, absolutely.
More stress.
Mm-hmm.
They put their body under a lot of stress. Physically, and so again, I think Americans in general, we live such a stressful life. I mean, no one sleeps anymore. Nobody takes any vacations, and if they do, it's because they're literally, at their breaking point, right? We don't take a lot of naps. We don't take a lot of breaks. We just try to fit as much into life as we possibly can, and that takes its toll on your body over time. Females, I mean, we got it. We got this.
Yeah. I would definitely say that.
Males will internalize it, and I think that's almost worse, in a sense, because females are typically a little bit better with their communication methods, too.
Mm-hmm.
No offense or anything. They just will talk about their problems with their 800 friends, and they're good.
Yeah.
Where
absolutely.
Guys are like, oh.
Yeah. No.
I don't know what to do.
Men definitely internalize their stuff, and that creates a problem down the road. Yeah.
They can.
For sure.
I hate to generalize, but.
I mean, it's, there's reason that it's accurate sometimes. So yeah, for sure.
Sometimes, yeah.
So studies have shown that over time, men's testosterone will decrease. But
Correct.
I think there's definitely a trend of seeing lower testosterone in younger men. So can you tell me a little bit, if you're seeing that, first of all, why you think that is? And then what's the difference in treating that versus somebody who's a lot older? Like, is there a difference in treatments and safety and things like that? Yeah,
that's a great question. So that is a prevalence that is occurring more often, where you have these younger males, so even in their mid-20s, that they're having lower testosterone. So it is natural for testosterone to decrease over time, especially once you pass like 35, etc. But in a younger population, it is more prevalent. There's theories that exist about what's causing it, and so it could be endocrine disruptors such as like plastics, etc. that we're exposed to, not having proper nutrition, not having proper exercise, not having proper sleep is a massive one, and those are all different factors that can occur. Not to take away from the importance of testosterone in men, but there's also in pretty much every male that I've seen, if there's a testosterone problem, there's almost always a cortisol or an adrenal issue as well. And same thing with thyroid. It's possible again to have all three, but if there's a testosterone or a thyroid problem, in my experience, there's almost always an adrenal problem with one of those two. And so. And again, I think that all goes to kind of some of the stuff that we've talked about, or that we just talked about with the endocrine disruptors, lack of sleep, lack of proper nutrition, lack of exercise, etc. So those are some things that can cause it. As far as treatments go, I'm probably more conservative. I definitely am more conservative when it comes to treating men with testosterone than most doctors, and the reason is because I prefer to give people a minimum effective dose for making them feel better. Like, what's the minimum that you need to be on to feel where you want to be, instead of over-prescribing it. And that holds true more so to younger men than anybody else. And so when you're dealing with a 20 to 30 year old that is having these symptoms. We've tested them. They have low testosterone. There are ways to go and improve that more naturally, especially if they have, I have some people who have come in, or some young guys who have come into me on testosterone therapy already. And it's a little bit tougher in that case to get them off of it. But if I diagnose this person with low testosterone, they haven't seen anybody else, they haven't had any other treatments, you can increase their production more in a more natural way. And there's different herbs for that. You can go and give a certain medication that will go and improve the signaling from their brain to their testes to improve testosterone production, and you can cycle them off that later, and they'll still continue to produce. So there's a few different ways to go about that. It's way safer. I think it's better in the long run to go that route, because obviously if you don't, I personally don't like taking stuff. So if I can help somebody not have to take something for the rest of their life, I'm going to do that, assuming that they're okay with that and they're willing to put in the work for that piece. But every now and then you do get a patient, especially if they're a little bit older, who we might go the more conservative approach and they're just not responding to it. And so at that point, you need to look at testosterone therapy. And between the two, if you went a more conservative route versus a more aggressive route with the actual testosterone, people on testosterone feel better a lot faster. Absolutely. I mean, you notice results in 2 weeks where they just start feeling a massive difference. And I know when in the women's podcast we talked about, it usually takes about a month. Men are 2 weeks. It's a very quick rebound. But if we went the more conservative route, now you're looking at about a month. If nothing's working in a month, then we may be a little bit more aggressive with our treatment. But I mean, the conservative route is obviously safer. Testosterone has this stigma that it's a bad thing. It's not necessarily a bad thing if it's done properly, and part of it being done properly is not over-prescribing it.
In younger men, do you need to be concerned about fertility and testosterone? Yeah,
that's a great question. So if you give a younger individual a testosterone injection and you dose it high enough, and for long enough, it can definitely sterilize them and stop them from that. From producing sperm and have fertility issues down the road. You can cycle them off of it and give them some medication if it's needed to get that sperm production back when they're ready to conceive. But that's going to be a little bit tougher challenge. That's why it's, in my opinion, it's easier just to go a more conservative route.
Okay. What are you noticing in younger men?
I have a client in particular that... So I wanted to ask you a question.
Yeah.
Correlatively, how many of your younger guys have abused steroids? And I don't mean just put Cypionate in their body.
Yeah, that's a great question. Yeah.
Can you comment a little bit on that? And are you their last resort?
So, yeah, great question. Typically, I have a handful of patients I can think of that abused testosterone when they were in high school or college, different things like that. And they, whatever, regardless of the reason that they did it, that's not important to me necessarily. It is a lot tougher, depending on how they abused it, to get them balanced on a more conservative approach. And so in that case, realistically, they'll be on it, for a much longer period of time. And
pretty difficult to reverse the effects too of being sterile.
It can be, exactly. And so that becomes a challenge. And I mean, one thing I want listeners to understand too is it's not always the individual who abused it too. I mean, I have patients who their doctors gave it to them when it shouldn't have been given. And for whatever reasons those were, that does happen, unfortunately, especially in kind of the men's wellness clinics that's all they're known for.
You have someone going to 2 clinics.
Yeah, exactly.
2 different doses a week.
Yeah, exactly. That could definitely happen.
Yeah.
And I mean, as far as am I the last resort, that's definitely possible if someone's wanting to get off of it. I mean, that's definitely possible, and it can be tough because I mean, the ideal thing would be, okay, we'll just stop doing it, or you can wean them off of it, and even with that, you know, they don't feel good. I mean, they feel like crap. And
you give them too much, they get accustomed to the feeling.
Exactly.
And it's very difficult for men versus women to say, this is enough, I still feel good.
Yeah.
You will almost never hear a male say, I'm okay running at 6 instead of 1,000.
Oh, yeah, for sure.
Are you kidding?
Well, and it's so, to your point, it's so funny how, I don't know what it is. I think maybe it's just the nature of men where, you know, if they know their friends are on testosterone therapy, it's like, well, who's is higher? And it's like, and then they, it becomes
a measuring contest.
Exactly. It's so funny.
It's so ego driven.
Yeah.
But you know, I think with the males that I have that are on it, they're all night shift workers.
Mm-hmm. Yeah.
And they have been for years. And, you know, they say correlatively night shift workers should be paid more because they're taking years off of their life.
Yeah, I would completely agree with that.
Because of sleep deprivation.
Mm-hmm.
And I think it goes further than just sleep deprivation, because if your quality of life is affected by sleep deprivation and you're not able to make decisions based upon how you truly feel because you're not well rested, you know, there's a lot of factors that play into that. Well, with my job, and feeding these people who are night shift workers, it's just as difficult because, you know, now they've got a 20-hour eating window some days, and other days they have a 12-hour eating window because they're sleeping.
Yeah.
And so when they're tracking macros, that can be very difficult. It can also be very difficult for fat loss because, again, you know, the days where you have the 20-hour eating window, you would either need to intermittent fast for those first 3 or 4 hours, which is hard. Or you would need to have them wake up and eat in the middle of the night, the second night when they're coming back, you know. So it's very difficult, the night shift working, and obviously there's a correlation now between night shift working and low testosterone, especially in men, and then receding hair, losing their hair with night shift working too. So if you look at a lot of the firemen, and I noticed this in general, like I went to speak at several different fire departments, and all of them are bald.
Yeah.
You know,
that's like, funny.
Whoa, you know, and, you know, you look at a lot of bodybuilders, right?
Yeah.
Who have been obviously on more than the recommended dose of testosterone for a very long period of time, and they're bald. So, you know, I think cautioning, especially with men, being way more conservative is definitely the route. Bump them up. If they need it, bump them up. Not give them so much that they adapt.
Yeah.
And cerebrally, they love the way it feels, but getting them to a place where they're like, I feel good enough.
Yeah.
This is good. I don't want to overdo it, because then we also run into that same conversation about cancer.
Right.
You know, if they've been using growth hormone in the past, that's the other thing.
Yeah.
You know, it's like, I feel bad for people who you are their last resort because they've done everything so crazy.
Right.
That now they're coming to you and saying, hi, you know, natural medicine doctor, can you help me with this because I've over-abused? And I find that is so huge when I listen to these men talk to me about their prior, you know, testosterone use. And I'm like, so did you start using, and I'll just say it, did you start using this like in your late teens, early 20s? Yep. Okay, what were you cycling? This. Whoa, okay. Jeez. And how many years did you do that? 8 years. Whoa, okay. So you can assume, you know, that a lot of the infertility issues and the IVF issues are also half male, not all female.
Yeah.
Not issues with just the
for
female.
sure.
Definitely.
Issues with the male, too, you know. And I know that to be true because I hear about it all the time, and I hear about it from just as many men as I hear from women.
Yeah.
You know, so I think, you know, hormones, especially, and with nutrition, in regards to male nutrition, when these people are taking the slower route, they almost never stick with it. They're so anxious.
Right.
They're like, yeah, you know, I'm going to a natural medicine doctor and he's got me on these herbs and I don't think this stuff is going to work. And I'm like, well, if you don't think it's going to work, then why aren't you being honest with him and just saying that you're impatient?
Right. Yeah, because I would rather make them feel better responsibly than them go to someone else that's going to mess them up even more.
Because there's a good chance they're going to leave you.
Yeah,
because
for
they
sure.
think you're too conservative.
Right.
You know, and I love the way you explain it, Matt. You're like, hey, are you a patient person? And you're willing to put in the work?
Right.
that's why I don't think macro tracking is a good fit for everybody. If you're an impatient person, first off, I can tell in your question and answering form if you are or not.
Yeah.
Because your expectations are that you're going to lose 40 pounds by June.
Yeah.
It's the middle of May.
That's a great, that's a great...
It's May 15th. You're not going to lose 40 pounds in 2 weeks.
Right.
I don't know where you even live. Is it on this planet Earth?
Right.
You know, but the same thing goes for HRT. Like, I think a lot of these guys hear their friends that go to the clinics, the Minute Clinic for HRT, and they're up in the thousands, and I'm like, dude, you're 40.
Yeah. And
you shouldn't be running at 1,000.
It's so common to see that too. It's insane.
20.
Yeah.
You know, so we look at everything in terms of like, can't we just get you to where you should be versus where you think you need to be? And again, it's that measuring contest. It's an ego thing.
Right.
I have yet to see a woman go, I want to be higher.
Yeah.
What? What do you mean?
Yeah.
Higher test, you know? You're trying to work on your gains like me? You know?
Yeah. Oh, it's funny because I'll have guys. To your point, it's like I have guys that come in and it's like, how are you feeling? Oh, I feel fantastic. Like, couldn't feel better. Okay, overall scale 1 to 10, how are you feeling? 10 out of 10, perfect. Can we go up like just a little bit more on the testosterone? It's like, why?
Sure.
You feel good. Why do you want to go up more? Like, it doesn't make any sense. But
everything's great. Why do you need to not fix something that's not broken?
Yeah, for sure.
It's so American.
It is.
It's so American. It's like, my car has a dead battery. Why don't you just go buy a new car? What?
Yeah.
Buy a new car, buy a new battery. I don't understand it.
Right.
You know? Why don't you just fix the battery?
Yeah.
Oh my gosh. Unbelievable.
So you guys talked a lot about expectations. How do you guys manage those with your patients?
So for me, I do my best to ask the patient kind of what you did, where you find out how patient they are, and I lay out the options at the very first visit. You know, once I have the labs back and I know that they're a candidate for some sort of therapy,
sure.
You have to go and the conversation I have is, okay, look, we can. Your level was this much, and we can approach this from a few different ways, but I need you to go and tell me, how realistic is it for you to stick? If we went a conservative route, how realistic is it for you to stick to this? And are you okay with waiting 4 weeks to start feeling better?
Mm-hmm.
And I'll get and then the other conversation is, or do you want to go this route? And they always ask, well, what's my recommendation? And I recommend conservative route if it's possible. And I have guys that come in, and they come in for their month follow-up, and I'm asking them, okay, well, how are you doing? And they're like, oh, I'm not feeling good, and I want to go straight to the injection. Okay,
mm-hmm.
What did you do? Did you do everything I told you? Did you take the supplements the way I said? Did you take the medication the way I said? Well, no, I didn't want to do that. Okay, well, we had this understanding at the very first visit, so and almost every time, every time the guy will be, you're right. Like that was my fault. I didn't follow what you said. So, okay, well, now that we have that out of the way, how do you want to approach this? Mm-hmm. My recommendation would be to do what we actually set out. Or if you're impatient, then we can figure out and go that route as well.
Yeah.
And so that's kind of how I manage my expectations.
Thing with nutrition. Mm-hmm. Exactly the same course. I actually talked about this in terms of nutrition and training yesterday. Okay. So if we used, instead of hormone therapy, I'm like, you have to have realistic expectations. My QA says, what are your short-term goals? If we find out that you have a hormone insufficiency, my short-term goal for you is to get that fixed.
Yeah.
You're not going to see any difference in your overall body composition probably until you get that fixed.
Mm-hmm.
And until you've been sufficient for several months at a time, I don't see you putting on lean body mass and losing body fat at a rate that a normal guy would lose body fat or gain lean body mass. And in most cases, it is more difficult to get them to a place where they're gaining lean body mass.
Yeah.
Because you got to have the test high enough for that.
Yeah.
You've also got to have their food sufficient enough for that. So where they're starting in is a place of depletion, the test will almost supersede the food, because you can't move food as fast as you can move test.
Yeah.
You can move test as fast as the person wants to move it. And again, I still agree with, if you're going to be giving injections, to keep it very conservative, because they do respond quickly,
mm-hmm.
Especially if they're not that insufficient. And
Right.
and they notice a difference in their energy level right away. So that's progress. So I go energy first. That's what you're going to notice the first 2 weeks to first month.
Right.
Energy first, sleeping better probably within the first 30 days. And then you're going to start to see the metabolism take a shift.
Mm-hmm.
You're going to start dropping body fat on your current numbers, on your current macros where it wasn't working before for you.
Yeah.
Or it was working slowly, very slowly. It's the same, trending as like with females. You'll just see that their fat loss is very slow. Again, a lot of that can have, can be due to prior dieting history or being an undereater their entire life. Or I get a lot of men that were overweight, and so now they undereat because they're so afraid to put that weight back on.
Mm-hmm.
And they just have that bad programming. And as a result of eating in a deficit for so many years, now they've got the low testosterone. And again, that's just correlative. I don't know about the stress factors sometimes, because men don't just come to me like a psychology session like women do. Unless I start asking the questions, they will not come forward with a lot of that information.
Yeah.
But if I ask them, they definitely do. So, and a lot of times it'll turn into like a crying session.
Yeah.
Where it'll just all come out.
Yeah.
And I'm like, well, that was great.
Yeah, for sure.
And I'm like, well, the great news is that there are people out there that are experts that can help you with this. And they'll get you to a place where you're feeling really good in a short period of time again. And they're like, really? I'm like, oh, yeah. Don't be embarrassed about it. I'm on it.
Yeah, yeah.
And if I say it, they're like, oh, really? Like, females need to be on that? I'm like, yes, they do.
Yeah,
yes,
for sure.
We do. Yes, we do need to be on that. But, it makes them feel more comfortable to know, too, that they're going to go to somebody. And a lot of guys, I will say this, most of the guys that find out they have low testosterone when they're working with me are like, hey, I don't want to be like one of those guys that, has issues with like raging or anger. And I'm like, no. You're not going to be.
Yeah, no.
They are not going to dose you like that. If you go to somebody who knows what they're doing, they are not going to put you on an exorbitant amount of, test. You're going to be on enough to get you to level.
Right.
Or to where you should be for your age. And again, a lot of these guys are post 35, and the ones that are under have abused in the past in most cases.
Yeah.
They've abused it, not just taken Cypionate.
Right.
So there's a big difference.
Right.
Like, people are like, oh yeah, well, he was on it because he was low. And I'm like, no. He was on that, and he was on growth, and he was also on a leaning agent, and he was also, so they don't really understand the scope of, like, what
you're doing to your body.
Yeah, and why were they doing these things, and what have the long-term side effects of those been. There's hardly any studies done.
Right.
On
it's
male
still too new.
HRT.
Yeah, it's still too new.
Female HRT is scary.
Mm-hmm.
I see why a lot of people don't want to treat females.
Yeah.
I see why a lot of people don't want to treat males, and the issues that we're going to see with, some of these doctors having lawsuits come back at them 20, 30 years down the line because they basically told these guys, and I've heard this from several men, I feel great, and I'm 45, and I run over 1,000. Why not have you? And these are the doctors telling these guys this. So douchey.
Yeah.
I mean, and you don't know the medical repercussions of that. You don't know the long-term side effects. But I will say this. In some of those gentlemen, the common trait is AFib.
Mm-hmm.
And I go, oh, you have a stressful job? Not really. You have a stressful life? Not really. Correlation is they're all running really high.
Yeah.
Test.
Yeah.
We don't know if
overdosed.
It's because their heart age is not, I would just be careful.
Yeah.
I would be throw caution on the careful side. So
for sure.
I 100% agree with you on conservative route for males. I'm kind of in the middle with females because a lot of these females feel so crappy.
Right.
Oh my gosh. And they do not want to be patient either. A lot of the females will go like 2 or 3 months and they follow the protocol, don't they?
Mm-hmm. Oh, they follow the protocol. Yes.
These females are so adherent, gosh darn it, but the males, you give them two pills that they've got to take and they might miss every other day. Right? So it's difficult.
Yeah.
I see that with nutrition too.
Yeah. That's good. I'm glad it's not just my world.
Yeah. Females are so adherent in nutrition, and males, I have to handhold them a lot. Now, they're adherent once they've been handheld for a while. but I have to keep reiterating why they're doing it. You see why you're doing this, right? And you understand why you're doing this, right? And when you eat out this week, you need me, right? Yep. I'll contact you. No, you won't. I'll contact you. Okay, you're right. Gosh, it's like a nagging wife. I've got a wife and then I've got you. It's but you need to have the macro mom, and you need to have the medical dad.
Yeah.
And together, I think it's awesome when they've been running the right amount of testosterone with the perfect nutrition. It's the beautiful combination that females get. It just takes them longer to get there.
Yeah.
Metabolically.
For sure.
So
in females, we talked about overexercise as being a really main component to decreasing metabolism. Do you see that as much in men?
I do. It's so hard though, because there's so many things with men that could contribute genetics, to their low testosterone. I will say this, of the men that I have that are low test, 100% of them are night shift workers, or they train more than 5 days a week.
Okay. Yeah.
100%.
Okay.
I don't have one male that is on nutrition with me that's low testosterone, other than a guy who's 60 years old that just found out that he's low. He's 60.
Yeah.
And he trains 5 days a week as well. So correlatively, I don't have anybody who doesn't train more than 5 days a week that's on test, that's being treated, that's under 40.
Now, can you tell me, is that different than in women, where overtraining, like, are you saying weightlifting more than 5 days a week, or are you saying running? What are you seeing mostly?
Most women don't weightlift more than 5 days a week.
No, men.
Oh, with men.
Yeah, because with women, I know it's a lot of running.
I'm going to be honest. Most of the men are cardio guys.
Okay.
They're cardio guys. When I change them over to weight training, when they get to start getting the testosterone, they start adding the lean mass real quickly.
Okay.
Because they're not ripping through glucose. Now they're ripping through body fat. So their body fat's coming down and their lean mass is going up. And I usually will have them get body mass index done along with testosterone therapy, because I want to see, as the coach, is this correcting itself, not only just in your lab work, but also your body mass index. So I use Scottsdale Sport Performance a lot for that. They usually run a special on Groupon here in Arizona, in Scottsdale in particular. So we use that a lot to gauge where did they start with HRT, with their lean body mass and their fat mass, and where are they headed, and they love it. In fact, I had a guy who is a 5 day or more overtrainer, early 30s, was so surprised he was low. He has been doing the body mass indexing now. He couldn't gain any muscle before, and he had a very hard time losing body fat. He's been on just low grade SIP. He's doing awesome. He runs about 600 now.
Okay.
Which is wonderful. And he goes, what if I do more? I go, don't do it. You're 32.
Yeah.
Don't do it. You feel good. You're training like a machine. We put on 12 pounds of lean muscle mass, this last year. It's awesome. Most people don't put that on at all in a year. They might get between 6 and 7 pounds of lean mass, especially if they're natural. And I always talk about the natural athlete versus the not natural athlete. But it's not shameful to take testosterone because you need it.
Right.
I think it's more shameful to abuse it than, anything. So
absolutely.
It's not shameful to be on it. If you need it, you need it. You don't want to run that way for the rest of your life. So, yeah, correlatively, I would say the overtraining population is the population that needs to be treated, and then again, the night shift workers. And obviously, a lot of the night shift workers are very active too. They usually train 5 days or more a week, and they never recover from the training sessions, so because they never sleep.
Yeah.
So again, oxidative stress. So there's so many factors, I think, that you can look at when it comes to men being depleted.
For sure.
Same with women.
Yeah.
More for women, I would say. We give childbirth,
Yeah, absolutely.
So, and our hormones are just so much more sensitive. We got 1 million.
That's so much more complicated.
Oh my gosh, yes. It's like this puzzle for men is so much easier to put together.
It's significantly easier.
Yeah.
That's why I do it. Yeah.
So, not to dumb it down or anything.
Oh yeah,
but
for
it's
sure.
just a much easier equation to solve with nutrition. It's so easy.
It is.
Give them 2 weeks, keep them on stable macros, make sure energy balance is around the same, and then start reverse dieting them when you see that their testosterone is more sufficient.
Yeah.
And it's great.
Yeah. So we talked about a lot of this already, but I think it's nice to recap. How do you know if your testosterone is being done correctly, or your male hormones are being done correctly in general? Because as we said earlier, it's not just testosterone.
It's an awesome question.
Yeah, great question. So if you're experiencing these symptoms, ideally what should be done is you want to make sure that thyroid, your thyroid, cortisol, and testosterone at the very least are all checked. There is correlation with if one of them's off, usually there's at least one more that's off. When you're looking at thyroid specifically, we talked about this in the women's podcast, TSH, free T4, free T3 are things that you want to look at. Reverse T3 and antibodies for Hashimoto's are some other things to look at as well. For the men's sex hormones, at that point you want to look at testosterone, estrogen, PSA. I didn't mention earlier, but FSH and LH are also really important ones to make sure that your body's still wanting to produce the correct the correct amounts of hormone. Prolactin's another important one, and making sure that there's screening being done for prostate cancer. So if that's not being done, I'm fine saying that it's not being done correctly. And so you want to make sure that that's the case. And then also you don't want to be being overdosed on it. So most of the guys that I see with testosterone, when I have them, or my goal my average goal for them is going to be between 600 and 800. This varies depending on age, because the older they get, you don't want that number being close to 1,000. You want to be a little bit lower, closer to 500. So that part will vary. If you're seeing someone that, this exists commonly where it's, the optimal level for testosterone for men is 1,500, 2,000. That's they're overdosing you. Are you going to feel good? Yes, but that's going to come at a risk of a bunch of side effects, that may, or health risks that you may not necessarily want. And I would say that's how you would know if you're seeing someone that knows what they're doing and that's doing it conservatively.
Yeah, definitely.
Cool.
Good. All right, so I think that was a great episode. To recap for you guys, so Dr. Matt just talked about all of the hormones that you might want to think about if you're running your hormones. So I would definitely go back and take a listen to that. In younger men, thinking about taking a more conservative approach. So I think it was important to bring up that testosterone replacement doesn't just start at testosterone replacement. There's lots of other things that you can do, especially if you're a younger man looking to conceive at some point, maybe something to consider. And then making sure that you're getting all of it in balance. So night shift workers, we talked about a lot. And so getting the stress and sleep in balance, as well as doing hormones and nutrition, all of it plays a role. And if you kind of pick and choose all of those things, you're not going to get very far. So I think that was a great episode. I'm going to turn it back over to Dr. Matt.
Awesome. Well, thank you for listening, everyone. We obviously went into a lot about testosterone, which is still to this day a controversial topic. So we wanted to flesh out some of that. A lot of the thyroid and the adrenal hormone considerations and side effects if they're imbalanced is also, we mentioned that. It's also discussed in more detail in the women's podcast. But we wanted to really flesh out some of the questions on testosterone and what to look for regarding that. So, Dr. Alex, thanks for co-hosting. Kelli, thank you for being here. We appreciate it. And everyone, I hope you enjoyed the show. Thanks for listening.